everyone. This is Jamie Marboe Nichols, and I am the host of the Heart of Dentistry podcast, where we take the ache out and put the heart back in to our dental profession. Please join me as I interview various guests who have opinions and also solutions to what is going on in our profession and helping us put the heart back in. Hello, everyone. This is Jamie Marboe Nichols, and I am the host of the Heart of Dentistry, where me and my guests take the ache out and try to put the heart back into our profession. And we are doing a second recording and interview with Dr. Brett Kessler. And thank you so much for sticking around and doing some more hot topics. I really like to talk about things that people are uncomfortable and struggling with. I go into offices, I have lots of clients, and while I can teach them the perfect probing angle and I can teach them the right coding and documentation to use, when they're struggling with the topics that I want to reveal, all of that goes to the wayside. So, welcome, Dr. Kessler, again, and thank you for joining us.
Jamie, how you been? It's been a while since I've seen you. It feels like forever.
I know. Time flies when you're having fun, doesn't it?
Absolutely. Hi,
That's
everybody.
great.
Thanks for coming back for more.
Yes, coming back for more. So, what I want to look at the time. Okay, so we talked about the ADA and we talked about basically your journey into it and basically each state's bylaws on substance abuse and within our profession and how people can call and get help and hopefully before it's too late and they don't have to necessarily lose their license because of it. They need to focus on their health and their life and that sort of stuff. So immediate past president of the ADA. And tell me, we're going to talk a little bit here about the addiction stuff, but also addiction is one segment of what's near and dear to my heart because of my own journey with depression and suicide. So, what have you seen? Because you hear all the stories. I'm sure I would love to have been a fly in the wall in your office when you're for your year. But what are some things that you can tell our listeners that you found out about depression, suicide, and possibly if there's a crossover with having addiction problems? Kind of tell me some of the stats that you've seen and in your experiences with that arena.
Elevating the discussion around wellness was one of my pillars that I wanted to expand as president. So it was one of my my big goals, and with sharing my personal story of going through addiction and then recovery and then my struggles along the way. And I hoped that it would empower people who heard me share my stories, that to live their best life. And we are in a mental health crisis in our country right now. And it's not getting better, unfortunately. And so a few years into my time on the board, I was invited to be the representative from dentistry to a clinician well-being task force that was headed by the National Academy of Science, Engineering, and Medicine, NASEM, and it was chaired by the president of NASEM and the U.S. Surgeon General at the time, Dr. Vivek Murthy. And so every month, all the different healthcare specialties and practitioners would come together and offer their perspectives on clinician wellness. I am an editor of that paper. Very proud of that work that I was able to represent, what it's like to be in the dental field. And I'm not just talking about being a dentist, but a dentist or dental hygienist, dental assistant, an office manager. It's really, dentistry's hard, and we've got our own special things to consider why it's so hard. And I start out by saying that we are very high achievers. We're the smartest of the smart because we decided to go into dentistry and not medicine, and we wanted to have a life outside of our office hours, and it affords us this great life. But with high achievers comes a strong drive to succeed, and we don't like to show any signs of weakness, and we develop coping mechanisms to deal with stresses of life, and sometimes they're healthy, sometimes they're not healthy. But anyway, there is a mental health crisis in our profession,
Yeah.
and strong number of people are showing signs of clinical burnout. Depression is way up, anxiety is way up, substance abuse is way up, and absolutely devastating suicide is way up. Paper
Yeah.
was published in our journal, JADA, Journal of the American Dental Association, last month or the month before,
Okay.
illustrating that the suicide rates among dentists are way higher than the average population.
Yeah.
And I
Yeah.
really believe that's due to the stress of the job and lack of resources and I mean, we do our best. The resources are available, but the stigma of us failing in any particular way is so overriding that suicide can seem like a logical excuse. And I've been there. I've
Yeah.
been
Do you think
there.
that's nature or nurture that being afraid to fail? Do you think that's a little bit of both?
I think it's both.
I do strength finders, Gallup strength finders with
Uh-huh.
all of my team members. And when you talk about achiever is extremely high, especially in doctors, the dentist. So I find that, and what I've learned through doing strength finders is that achiever, they never stop to celebrate. They go on to the next thing. And then you put learner in there too, and they never stop and say, wow, look what I achieved, or look at what I did. They're never quite satisfied. They're always hungry for that next high, that next achievement of whatever ever that may be. So do you think it's something we're born with? Do you think it's
I
something
think
that
it's I think it's both. I think that we to get into dental school today, I visited 31 dental schools the last 2 years, and the average GPA at some of the schools are 4.0. They have to turn away people who have perfect straight A grade point averages. That's how competitive it is.
wow.
Yeah. So so they have to be that way to accomplish, but it's not human, and it comes back to haunt us if we don't stop, spend some time and smell the roses, and in the Covey seven
Celebrate.
habits. Yeah, the Covey seven habits, finding time to sharpen the saw, habit 7.
Mhm.
And I can tell you, I got to use all my mindfulness training this past year as president, because the challenge was there every single day. There was amazing high amount of stress that I had to be ready for, so I could be my best self. But and then we're surrounding ourselves with high achievers. I'm just going to use the dental school metaphor. We're used to, when we entered dental school, before that, used to be the ones that are setting the curve. And then all of a sudden you're in a cohort of people that are used to setting the curve, which now makes you average.
Mm.
And that
The
stress
bell
of,
curve. I get
right, that bell curve, now you are with people that are equal to you. So now you're an average. And I've never, felt good about getting a C, but that's where I am now as a dental student. And I ended up failing occlusion and morphology in dental school. So I was really smart. I can rattle off all sorts of information, but when it came time to me using my hands, I had no art training whatsoever, and I
yeah.
failed. And I had to go to wax camp over the summer and learn how
Oh
to
my
how to
gosh.
how to do
Wax
waxes.
camp, not
Yeah,
wax
yeah.
camp.
Yeah, wax, and we would sing songs, kumbaya songs around the Bunsen burner and roast. No, just kidding. But I learned how to do it, and
Yeah.
and I could tell you the education modalities now, or it used to be, you had to be perfect from right out of the gate, and now the schools are recognizing that is very damaging to the educational process, and we have to honor people on where they are in the progress and let them progress along the way that they do it best, so they can actually learn and not go into this mental illness spiral because they didn't, set the curve that they're used to
So
setting.
are they cleaning up some of the dental and hygiene schools on some of that hard knocks mentality? Because I have stories from my doctor that I
Mhm.
worked with for 24 years of him spending hours and hours and hours on a wax tooth, whatever it was. And he would, when he turned it in, and then right in front of him, the professor would take it and squish it with his fingers and say it wasn't good enough. Oh my
Yeah,
gosh. I said, what? How is
I've
that
heard those
even
stories too.
possible?
I've heard those stories too, and but I didn't have those
You didn't have that
experiences. But I
experience
could tell you, I failed miserably trying
with,
to learn how to do wax ups, and it was very hard for me. But I tell you, I got
yeah,
so good at it. I did all my own wax ups as a cosmetic dentist practice. I love doing it,
yeah,
because I learned how. But no, and I wouldn't say, I would say that the education modalities have evolved, which is consummate
great.
to the current generation of students, because they're much different than I was, and
Hmm.
and they've had a different life experience, and digital world versus an analog world, and different pressures and different learning ways, and and we honor that, and it's beautiful to see, because the students coming out today are the smartest of the smart. They come out, barely competent, though, because there's so much more for them to learn. And when I speak at the dental schools, I implore them that your education, when you graduate, your education is just beginning. It's not
Yeah,
over.
right.
Don't stop. Keep your foot on the gas. And, it takes about 6 years before you really get your hand skills under, in a good way. And the best they're going to be is at 6 years, but they're nowhere near as good as they could be in year one.
Hmm.
And that's just part of the growth. But I could
And
tell
I
you
think that if
they
they
get
if they
there.
hadn't gone through some of the failures, let's just say they're not seeing the failures, they have succeeded, they have done well, and then they get into a private practice as whether usually an associate for the first
Mhm.
10 years, and they fail miserably with being a leader. This is what I'm finding as a coach. And that is so hard to coach. You're making me think about some of my own clients and their associates and even some of their hygienists that are high achievers. And so to them, that's also a little bit of a form of failure if they can't keep a cohesive team together or they can't, because they just want to do teeth. They just want to work with teeth. And so that seems to be another part of the pressure and going back to being the high achiever and now having to deal with something outside of dental school, people and hearts and humans and uh, having some being an empath to some of the issues that are going on because they maybe never missed a day of work or never missed a day of school or whatever. And that really can all come together and create some of this depression and
I saw a
substance
stat
use.
somewhere along my travels last year that 50% of dental students entering school today have never cashed a paycheck, which means they've never worked a day in their lives. They've never waited tables. They've never
That
swept
is
floors for money.
crazy.
Half.
That is
Okay.
crazy.
And so we get, because they're so focused on achievement in the educational realm, which is what they have to do. Many of them are inexperienced in there, and so they get out of school, they have competency, they've I guess established competency, and we're able to practice, but they have to do this very difficult practice of dentistry, very difficult procedures on very difficult patients, and it's very hard, and they're expected to lead a team,
Yeah,
and it's a
it's a
lot.
lot of pressure
Mm-hmm.
where a lot of medical doctors maybe go in and go out, and they have, I don't know, we won't even go
they're
down
not
that.
they're not as procedurally oriented, though. It's
Yeah.
more thinking, and so we are procedurally oriented in our profession. But I can tell you, the younger generation today are so much better about identifying when they are struggling and asking for help, and
Oh,
and
that's
talking
great.
about addiction, and seeking help for depression, much better than my generation and above. I'm Gen X, and so they in dental school, every dental school had an amazing resources for the students. The new dentists have amazing resources, and they have these, discussions open and honest that, I'm open and honest about my struggles. You are with yours, but many of our generations isn't, or the younger
No, no,
generation
you
is,
kept
which is what
it.
which where I see a bright future as a result of that.
So we're trying to put the heart back in as we wrap up this discussion on the struggles and within and the pressures of being a dental professional. You've given a lot of good golden nuggets and takeaways. If somebody is still struggling with the pressures of owning a business or
Mm-hmm.
practicing and in running a team or things like that, what are some of the best advice you can give to these new practice owners or sometimes older? Because let's be honest, you could have owned it. I remember this dentist. He'd been a practice owner for 10 years and struggled in the last three. And he's like, I'm doing the same thing as I did 10 years ago. Why am I struggling with keeping team members? Why am I da, da, da? What is the best advice you can give to these people that are just finding that they're burnout, yes, but it's because of this, and this, and they just can't practice dentistry the way they wanted to or the way they thought they could when they graduated. What's some great advice you could give them?
So I view wellness in five dimensions. And I think, if you look at these five dimensions and make sure you're putting effort into these five dimensions. Okay, so physical, mental, emotional, spiritual, and social. And I'm not going to go into them there. It's a full couple
Yeah,
hours discussion, but
I like
spending
this.
time intentionally, growing those areas of holistic wellness is really key. And then living by intention, because a lot of times we just kind of put our head down and we just start drilling our drills and expect everything to work out. It's not the case anymore, and we have to be more dynamic than that. And when we're well, our brain is in a much more creative space. We're in a growth mindset, and that's where I think the benefits of asking for help. I've had mentors and coaches my entire career, but when I
Mhm.
got sober, I got inspired to live my best life, and I was investing in that because that's really what I wanted. And I keep and I share about this across the country in my wellness journey. If the best athletes were coming on the Olympics start this weekend, the best athletes in the world all have coaches. Why can't the best dentists? Why
Yeah.
shouldn't the best dentists? So seek help. Go up to somebody in your that you look up to as a dentist or dental hygienist or whatever, and ask them, how did they get to where they are? What struggles did they
Mhm.
face? What were they afraid of? How did they get through that? And how do they maintain it? How do they stay focused so they're always on that growing phase? And so, and there's so much wisdom to be shared in this profession that is untapped because we're afraid to ask.
Mhm.
And so I recommend, filling your buckets in your wellness journey, and knowing you don't have to do it alone.
Yeah, I love that. Thank you for that. I'm in a mastermind group where we talked about the upside down pyramid and how it's ingrained in us to think that the patient always comes first, and then the team or family, whichever way, whatever part of the five that you just mentioned, and then you're at the bottom. And it really needs to be the other way. It needs to be you at the beginning, is what I'm hearing you saying. So you
Yeah.
need to be taken care of because by the time you finally get to take care of family and team and then patients, if you do it upside down, there's nothing left of you to
Right.
give. And
And
so
yeah.
and so you have to have good rest. You have to have all of those five pillars, I think, are very
Mm-hmm.
important. So
You are
thank
your
you.
most valuable asset. Take care of yourself as such. And
Absolutely.
I don't care
100.
where you are in your professional journey or what role you play in the dental office. You are a leader, and the best that you can show up will be, the to your success will be the most valuable part of your success and
I know
fulfillment.
I know that when I was going through my dark time, depression and contemplating suicide, it was when I wasn't taking care of myself. I was absolutely on a plane going somewhere every single week and taking care of all my clients and their needs, and I never wasn't ever taking care of mine. So great advice, great words of wisdom there, Dr. Kessler. And so thank you again. And we're going to do one more part series. So stay tuned. Here we go. We're going to end this one and we're going to go into part 3.
Thank you, everybody.
The Heart of Dentistry podcast, where we take the ache out and put the heart back in to our dental profession.